hopefully we'll answer some of your questions, and we look forward to hearing from you. So make sure if you have any questions, you put them in the chat or in the Q&A. We can certainly get to those. We'll be doing introductions in a moment. I wanted to thank our sponsors, the Maryland Hospital Association, Mosaic Group, and Mercy Medical Center for their sponsorships for today's speaker series. So I'm just going to do some round robin. We're going to go around to each panelist and we'll have them introduce themselves, their name, their title, their company, and why maternal health is so important to them. I'm going to start with Delegate Pena-Melnyk, if that's okay.
Absolutely, and thank you so much, Traci, for your work. And it's an honor to be here with these wonderful panelists who are people that we are grateful to, and I have a lot of respect for. So maternal health is very important to me. I am the Vice Chair of the Health Committee for the House, but I'm also the Chair of the Public Health and Minority Disparity Committee for the House. So every year I see the data, I see the bills that come in, and the fact is that Black women are dying almost 4 times at a higher rate than white women, and especially right after giving birth and within that first year. So every year we see all these bills that we put in to address these issues. So this is something very close to my heart.
Dr. Atlas, would you like to introduce yourself?
Sure. Good afternoon, everyone, and I'm very honored to be a part of this. I'm Rob Atlas, and I am a chairman of OBGYN at Mercy Medical Center. I have specialized training in maternal fetal medicine, so this is right up my alley. I've been here in Maryland, well, back in Maryland, I should say, for the last 15 years, and I guess really a passion of mine has been maternal health. I sit on a number of different committees within the city of Baltimore City, and also I sit on the state maternal mortality review, and I've been doing that for the last 15 years. And it breaks my heart every year that we go through the anywhere from 40 to 52 women who have died in our state every year over the last 15 years. And so it's a passion of mine of trying to improve health. I think Representative Pena speaks absolutely. We have a huge disparity in health in our state. So I'm honored to be here to have this conversation.
Thank you for taking your time out from your day. I'm going to transition it over to Blair M. Blair.
Thanks, Traci. Hi, I'm Blair M. I am the president and CEO of the Maryland Patient Safety Center. For those who don't know the Patient Safety Center, we are a nonprofit established by the legislature over 15 years ago to enhance and improve patient safety in the state of Maryland. So obviously all aspects of patient safety are important to us, and specifically we've worked a lot in maternal child health because there are these issues associated with maternal mortality and morbidity, the conditions that predispose women to having troubles with their pregnancy and afterwards. Like Dr. Atlas, we see the racial disparities, we know we need to fix them, and we know we're dedicated to work on that from any aspect that we can. Prior to coming to the Patient Safety Center, I was the Chief Medical Officer at Holy Cross Hospital and Holy Cross Health for 19 years. And some of you may know, Holy Cross is the largest maternity center in the state, having almost 10,000 deliveries a year. So it's something we dealt with every day at Holy Cross. And a lot of successes, a lot of wonderful outcomes, but also the troubling ones that we know we need to address. And it's not just specifically medical issues. There are issues of social determinants of health that involve our pregnant or pre-pregnant women that need to be addressed. And I know Representative Pena-Melnyk, Delegate Pena-Melnyk, and others are looking at that because we just need to get better.
Thank you. And last but not least, Andrea Branscome is joining us from Truist. So we're excited to really have that business perspective. Welcome.
Thank you, Traci. Hi, good afternoon, everybody. My name is Andrea Branscome, and I'm the HR Shared Services Delivery Manager for Truist Financial Corporation. For those of you who are not familiar with Truist, we were just created last year in 2019 from the merger between two great companies, BB&T and SunTrust. And so today we make up the sixth largest U.S. bank holding company. We have right at about 55,000 teammates between the U.S. and Canada. And in Maryland, we have right at about 2,000 teammates. 64% of those teammates in Maryland are female, and 49.5% of those female teammates are under the age of 45. So we have a really great population of females and female leaders in Maryland in our organization. At Truist, we insource our leave administration. And so today, my team is responsible for all the time off and absence policies and programs, leave and absence, including FMLA and other state leave entitlements, and workplace accommodations. But while I represent the employer perspective today, I'm also a female leader in corporate America, a wife and a mother of two boys. One is age 11 and my youngest is age 8. Both of which were born while I was employed at BB&T. And I'm very happy to talk to you guys today about the ways you can support your teammates and the positive impact it can have on your recruitment, your engagement, and your different kinds of retention efforts that you may have. I think those topics hit really close to home for me, especially the recruitment piece, because I was actually pregnant with my first child when I interviewed at BB&T back in 2008. And their robust and very generous maternity benefits are one of the main reasons I decided to join the BB&T family so many years ago. So I'm really excited to be here, and I really thank you all for allowing me to be with you today.
Thanks, Andrea. We look forward to hearing more about the programs and services with Truist. And I also want to give Jordan Sasanya an opportunity to introduce herself, working on the back end.
Hi, everybody. I'm happy that you guys could all join us today. So I'm Jordan Sosanya, and I'm the Marketing and Business Development Manager at HCAM. So I did a lot of the behind the scenes work for the event, and I'm just on here in case there are any technical issues. So I'm happy to have you guys all here.
And a mom as well.
And a mom as well.
So we're going to get started. And again, I'm Traci Kodeck. I'm the CEO of Healthcare Access Maryland. Maternal child health is a passion of mine, always has been. I was a Peace Corps volunteer in the Caribbean for 2 years, working with pregnant and parenting moms and families with children under the age of 5 to get them ready to learn. But a lot of their work was around the community development and getting the children ready to learn for school. Their healthcare system is completely different than ours, obviously, based on the British system. And so I've always had a passion of maternal child health, and I knew we were going to do a speaker series on this topic. I'm a mom to a very exciting, sassy, independent 7.5-year-old who came to me through a long journey of infertility. And so maternal child health is very important to me through my experience of trying to become a mom and multiple losses. So as we talk about this journey of maternal child health and maternal health, we can't forget about that long process that many women go through and how we need to support them. So I'm going to ask Dr. Atlas to set the stage of maternal health in Maryland. We heard a little bit in his introduction, but you could just give us from a data perspective an overview of maternal mortality and a little bit on the morbidity piece.
Yeah, so I may say a few controversial things, and I recognize that, but it's actually in the maternal mortality review paper that is submitted to the governor's office, that is published yearly. And essentially, if you look at maternal mortality in its entirety related to Maryland, we actually are doing better than many states in the country. Having said that, we are not doing as well as we'd like, and certainly not as what is recommended as the 2020 health grades. Our maternal mortality is down about 26%, but as we sort of started to say, and as Representative Pena-Melnyk said, the disparities in what we're seeing is just tremendous. And it's 3 to 4 times the risk of a Black woman dying from maternity as a white woman. And it just is something that we can't do. And I know that some of the bills out there are looking at implicit bias. I know Ms. Kodeck and I, we discuss all the time about biases and implicit bias. And I think it's a lot to say that implicit bias does impact how physicians, healthcare workers see patients. I think there's a huge problem of access to care throughout our state, even within our city that has so many great hospitals like Hopkins in Maryland that provide care. We're still having patients who come for no prenatal care. We know that women who don't have prenatal care are associated with a huge increased risk of complications and death. I want to mention the opioid addiction problem, because in reality, if you look at total number of women who die every year, it is the #1 pregnancy associated cause of death in our state. You know, you hate to talk about politics. I actually like to talk about politics, and I'm happy with the results because I actually think we may be able to expand Medicaid for a year here in our state. And I'm hoping that programs can occur and be brought about to help with our substance use disorder patients to try and get them the care that they need and not die, whether it's, most of them are dying outside of pregnancy and outside of the 42-day window where Medicaid is picking that up. So that's just a smattering. I mean, there's so much more we can talk about, but that's a little bit of data for you.
Thank you, Dr. Atlas. One of the things you talked about is around 40 to 52 women are dying a year related to pregnancy, and with the opioid epidemic being the #1 cause associated. What are some of the other causes that you're seeing across the state?
Well, I mean, when you look at the associated causes, #1 is the opioid. Other is trauma, motor vehicle accidents. Intimate partner violence is a problem that we have to address. Gun legislation, you know, whatever, that is a risk. When you look at the #1 cause of maternity-related disease and death, it's hypertensive disorders. And I know that our state is just embarking upon, the Maryland Department of Health is now sort of, we're looking at all the hospitals on hypertensive disorders and how we do this. I should mention that our friends at Hopkins got a $10 million grant to look at severe maternal morbidity. And there's a pilot program going on this year for 6 hospitals in our state, Mercy being one, where we're actually starting to try and pull all our severe maternal morbidity and get a hold, because I don't think we at our level of hospitals recognize the severe maternal morbidity and what we need to do to reduce that risk as well. So those are some of the other things.
Thank you. Last year, Delegate Pena-Melnyk, you sponsored a bill requiring implicit bias training for all OB providers across the state, and thank you for that, for sponsoring that. Can you share more about the bill and what was the impetus for that?
Thank you for the question, and thank you, Dr. Atlas, for your work. The impetus for this bill was really the numbers, right? The data, the science, right? It's great to believe in science, isn't it? I mean, it tells you exactly what the problem is, and you can clearly see that there's a big disparity between Black women, white women, Latina women, and others. So I worked with a lot of the different groups. I worked with MECI, who represents a lot of the physicians. I had to bring to the table the Hospital Association, and they were a great partner, and so was MECI, and everyone else that was going to be affected by this bill, because it actually requires the development of a program that is evidence-based. I work with Johns Hopkins, so I was aware of the $10 million that they just received, a grant, and they came and testify as well. And they have to develop a program, again, that is evidence-based implicit bias training program for all healthcare providers that touch a pregnant woman, plain and simple, plain English. So the program had to be developed before or on January 1st, 2021. So in a few months, it goes into effect, which I'm very excited. Our committee over the years have heard many different bills. I mean, we were the General Assembly in 2000 that actually created the Maryland Maternal Mortality Review Program in 2000. And then in 2018, we put in another bill that actually created the Maternal Review Stakeholder Group, right? People that experience a loss or have that so that they can review the findings and recommendations of this report. So the General Assembly has been very much involved. Look, we're not the most, I would say, and I'll speak personally, I'm not the smartest person in the room, but I can see a problem, right? And I can bring people to the table that have the expertise and try to find solutions. So having an evidence-based implicit bias, unconscious bias training program is really important because we all come from different backgrounds. And it's important to have some empathy, and understand the culture and try to address it.
And Traci, can I
Yes.
add something to that?
Yes, I was going to ask you, Blair. Yes.
Yeah, so we're working with the Hopkins MD Mom program on this piece of implicit bias training. In fact, we're coordinating the training. I have here the letter that's going out today to the hospitals involved, signing them up for the training, Delegate Pena-Melnyk. They will comply. And we've got—
I feel like you just gave me flowers. Thank you.
Anything I can do for you. We have it 2 phases. Early next year, we'll be getting them trained, and both in compliance with the Maryland bill, but also the right thing to do. This is a piece of what we need to do. It's not, as Delegate Pena-Melnyk says, it's not the only thing we need to do, but it's a start. And we're very, very proud to be involved in that because it's again, the right thing to do. I'm also very happy, Dr. Atlas mentioned this, that the state and the department are moving towards both investigation and action on maternal morbidity. We've looked at maternal mortality for a long time, and as we said before, those are relatively small numbers compared to all of the patients who have trouble with their pregnancy. If we can get the data on morbidity that we are starting to do now, and the department is backing up, we can start acting on that too. So there's good news in terms of the direction we're going, but as always, it's in the details. It's actually getting it done.
Thank you, Blair. And I agree. One of the challenges often is that women are choosing to go back to work over their health care. They're choosing that they have to return to work as an essential worker, as a single mom, as the breadwinner in the family. And so I want to turn it over to Andrea to bring us back to Truist's policies and what are some of the outcomes you've seen regarding the health of your population and retention for those with, and talk a little bit about the policy that Truist has.
Thank you, Traci. Well, as I mentioned a moment ago, Truist is a relatively new organization. So when we were looking at our Truist Leave programs, it was really important to us that our programs foster a culture of support for new mothers. We evaluated a lot of data and found that offering a robust maternity leave program could increase female intent to stay by over 4%. And that was just some general studies originally when we were looking at creating our programs. But as we'll see in a moment, we've actually seen a much greater impact in our retention metrics, which makes us really excited for the direction that we're going in. Today, Truist offers a full 16 weeks of paid maternity benefits. This is comprised of 10 weeks of paid sick leave and then 6 weeks of parental leave or baby bonding time. And when creating our maternity leave program, we took kind of the best of both of our heritage organizations. So SunTrust offered 16 weeks of paid leave, but had a year waiting period of eligibility. And BB&T offered no waiting period, but only 12 weeks of paid maternity leave. And so Even though our maternity leave program is not technically job protected unless it's covered by the FMLA or state leave entitlements, our teammates do not have any negative employment consequences for actually utilizing these benefits. And in the event that a mom has some type of pre or postpartum complication or health problem that requires them to be out of work for greater than those 16 weeks, we offer an employer-paid disability program that pays for teammates at least 50% of their total compensation tax-free. So that is also one other way that we help our teammates to not worry about the financial components of being out on leave. Now, while a teammate's actually out on leave, we disconnect all of their access to our systems. And while this is done for many reasons, one reason is to ensure that our teammates are focused on their health and not on work. And in the case of our birth moms, it also means the focus of the well-being of their child too. And so it's really important for us that our birth moms not only have plenty of time to heal physically, but also emotionally and mentally before trying to come back to work. But before we allow them to actually come back, we would require them to be released by their physician. So that ultimately means that they're having to go to their postpartum checkups, which has so many positive impacts on their physical health, but also their mental health as well. Now, I'd be remiss, though, if I didn't talk about the fact that I just mentioned 6 weeks of parental leave, and we offer that to our non-birth parents as well. So our non-birth parents, which would include foster and adoption situations, have the same 6 weeks available to them to take. And they can take that either intermittently or all at one time, whatever works best for the family. And while this particular benefit, this parental leave benefit for non-birth parents, doesn't have a direct impact on our Truist birth moms, it does have an impact on the lives of the other women in our communities. That kind of support and flexibility, I think, is really invaluable, that families can choose what works best for them. If it's best for them to have the non-birth parent at home right at the beginning when the birth mom is healing the most, maybe physically and adjusting to being a mom, then they can do that. If it's better for the family to have the non-birth parent home on the back end of the birth mom's maternity leave, to be there just to offer that emotional support as they adjust to going back to work, then they can do that. And so I think this is just a really important benefit that we also offer to our teammates. But in addition to all of that, I think it's also important that we look at pairing family benefits with parental leave. And so we also offer things like infertility services through our healthcare plans, mother's rooms, emergency daycare, daycare reimbursement programs, and adoption assistance. And so I think you have to look at an entire picture of family planning and family support when we talk about maternity leave and parental leave programs. Now, because Truist leave programs are still really what I call in their infancy stages, we haven't been in place yet for a year. I'm actually going to share some metrics with you from our Heritage SunTrust organization from when they updated their maternity leave program from 10 paid weeks to 16 paid weeks of leave. So in the year that they implemented their 16 weeks of paid maternity leave, they actually experienced an 8% drop in overall female turnover. And when we look specifically at our Generation X and Millennial group, that effect was even greater. So among our female teammates in those generational groups, the voluntary turnover fell by 14%. And if we look specifically at the termination reason of family reasons or personal, the voluntary turnover fell by 11%. So we have some significant improvement in our retention of our females once we implemented our paid maternity leave benefits. Now, I know that's just a single issue facing women that needs to be solved. And I think there's a collection of issues overall that prevent us sometimes from retaining our women leaders. But I do believe that our maternity and parental leave programs are just the start of what we hope to accomplish in the future in retaining them.
Well, I think you're going to see an increase in people applying for jobs at Truist, that's for sure. Benefits.
Absolutely.
Many people do look at those maternity benefits, infertility coverage, paternity leave, parental leave. And so, of course, that's huge for many people across the country. Delegate, I wanted to talk, kind of pick your brain a little bit on maternity leave and where it's sort of been in the state of Maryland. I know it's a topic that comes in and out of session often, and where you think that sits for our state.
Well, I can tell you that the U.S., right? There's a report, according to a 2019 UNICEF report, which analyzed the world's richest countries and that are most family-friendly. I learned that Estonia leads the field for new mothers with over 80 weeks of leave at a full pay. At the bottom of the table is the United States with a grand total of 0 weeks, and was the only country in the analysis that offer absolutely no national paid leave. So that's where we are. So every state is different.
Yeah.
And in Maryland, I know that the Speaker of the House, Adrienne Jones, has announced that will be one of her main priorities for the 2021 session. Okay, especially given the data on maternal mortality. So you're going to see that we are going to be, we have paid sick leave in Maryland. We passed a bill last year, but we must, deal with this particular issue. And she has announced that this will be a priority for her coming up in January. But we're all over the place. That's because it should come from the federal government, right? Where the federal government should make a decision, but they have not. We don't pay leave in the U.S., so every state it's different, but we will be addressing it in 2021.
Fantastic, and hopefully it'll be one of the goals of the next 4 years of the federal administration to address it on a national landscape.
From your mouth to God's ears.
It's certainly an important topic, obviously. And, I know I have family that lives in Sweden and had 18 months at least of paid leave. And they actually chose to move from the United States back to Sweden for that very benefit of health coverage and maternity leave, so they could take care of their 3 kids. So we know that other countries are doing better. Blair, what are your thoughts on maternity leave and how it impacts the families from a safety perspective or from a business perspective?
Well, I think the other speakers have spoken well to how it affects everyone. There's no question that it is the right thing to do, but we have to come to some consensus. What I'd like to talk about, add on to that, is insurance coverage. And it is the insurance coverage postpartum. A lot of coverage only lasts for a certain number of weeks after delivery. And a lot of the issues that we see and what Dr. Atlas talked about can occur many months after delivery, whether it is behavioral health, mental issues, or it is other medical issues associated, whether associated with the pregnancy or not, but under the stressful conditions of maternity. And there is a lot of effort now to increase postpartum coverage by both private insurers and by Medicaid, so that's the state issue, up to a year after delivery. We think this can address that patients or mothers after delivery will have access to excellent health care for a year after delivery will really help a lot with a lot of the postpartum issues that we see, and maybe other general health issues, perhaps diabetes and heart disease or obesity can also be addressed because they have somewhere to go. Again, access to health care and getting it paid for is a major issue for us. It's the right thing to do. Being able to get it done, I'll leave that to Delegate Pena-Melnyk sometimes, but it is what we need to do. One other thing probably to add to this, and it's that discussion of maternal leave or any kind of leave in this age of COVID. this doesn't come from the medical literature, this comes from the Washington Post, but also other news services, which I think are all real news, not fake news, is that women are being significantly more affected by the COVID pandemic and homeschooling than men are, and are leaving the workforce at a much greater number that may not be reversible due to the children being home and being homeschooled. That burden is falling upon moms, inordinately upon moms. There are reasons in society why that happens. We all understand that, but because of that, it is moving women out of the workforce at a time when they may not be able to afford to, or it is even the right thing, and may be affecting their healthcare accessibility. So those are issues that really, I think, need to be looked at, because it's all tied together. Healthcare doesn't live on its own. As I talked about the social determinants before, access to adequate housing, adequate food, adequate transportation are all important to people's healthcare. And having the ability to work, and since we have work-based healthcare insurance in this country, the ability to work and get that healthcare is also important. So it's a bigger issue. I'm sorry, it's just a bigger issue than even any one of us can handle, but all together, hopefully we can address it.
Agreed. As an ombudsman, when I first started with HCAM 20 years ago, my role was to educate pregnant and postpartum women about their Medicaid benefits. And I struggled every time I had to tell them that their benefits would end 2 months postpartum and they needed to reapply for benefits. And I can't imagine, as a mom who had a C-section at 8 weeks, having to schlep my child down to a city agency and apply for benefits again. Again, this was pre-ACA when everything was paper. And so I hope we move and do the right thing in the state of Maryland. We did have
I can tell you that that's
yes.
another bill that someone's working on, and that you will see that conversation take place in 2021 as well.
Wonderful.
I just wanted to jump on real quick, and we're talking about postpartum care, and Dr. Ide really brought up the importance of that. But we have to have programs in place in order to help these women, and currently I think we don't have the programs. But the one thing I wanted to talk about is the health of women before pregnancy and the move for preconception health, that period of time that we may actually be able to impact outcomes, that we just we're not doing a good enough job. And I know that I've spoken to, at least at Mercy, every other year I talk to them about preconception health and the importance of what internists can do. And I talked at FEMA recently about preconception health, the importance of moms getting into pregnancy and being in pregnancy healthy. We have to do something with the family breakdown, nutrition, all these things, as Dr. Ide said, to try and help improve overall outcome and reduce that maternal severe morbidity as well as mortality.
Yeah, and I'm curious, Andrea, what are some wellness initiatives that are happening within your space? We do have a Q&A for Truist. I want to make sure we get to that, but I want to keep going on this topic.
Absolutely. So we really encourage our teammates to take a really proactive approach to their health and their wellness. And so we offer several programs. Our primary one is our wellness program, though, through a company called Peak Health. And that company actually has on-site nurses that come and takes probably about 20 to 30 minutes with each teammate who is a participating individual, somewhere between 1 and 4 times a year, where we really focus on helping the teammates make better health decisions, whether that's eating smarter or exercising, and different ways that they can incorporate that into their daily life, taking regular health assessments, and really talking to them about how they can just be overall healthier. And by participating in this program and attending these appointments with these registered nurses, our teammates are actually able to earn medical credits up to 20% of their medical premium costs. So it's a significant savings for our teammates to participate. So I think that doing those types of programs, we also have gaps in care programs, we have case management programs, and those other types of things that we have added on to our healthcare plans are really important avenues for helping your teammates stay healthy. And I think there's other ways to do that as well. Our CEO is a really big on eating healthy, and he took all of our junk food out of our vending machines and replaced it with healthy snacks many years ago. That was a really hard change for a lot of us, but it's small things like that that you can do to help your teammates just live healthier.
Thanks, Andrea.
What about time? What about time off? Do you give time off to get those benefits?
We do. So we actually, in addition to our vacation time, we also offer time to attend those appointments that I just mentioned. Those are paid for. But also we offer an 8 hours of wellness every year that a teammate can go and spend time, whatever that means for the teammate. So it could be their physical wellness, right? So it could be going and meeting with a nutritionist, meeting with a trainer, those sort of things. It could be financial wellness and meeting with a financial planner, or maybe doing some type of closing on a home. It could just be an emotional or mental wellness day where they essentially just take another day for themselves and go to the spa or whatever that means for them to relax. And so we offer those as well to just take time away. Now, we do also offer some other time away that I think is really important. And I don't know if now is a good time to make a small transition, but, I feel like one big piece of employers engaging and being a part of wellness for their teammates is also being active in their communities. And so one of the things that Truist does is offer 16 hours of time off for our teammates every year to volunteer in our communities, but then also another day off for us as departments or small groups to go and participate in what we call a lighthouse event, which is going out as a group and doing a community service event. And Truist gives us $5,000 to go out and do that. So every department, line of business gets this funding every year to go out and be a part and make a difference in our community. And I think that a lot of what we don't seem to, understand more globally is that we are only as great and as good as our communities are. And so the better, the healthier and the better financial state of our communities, the better as companies we're going to be. So I think that's a really good place to start as well, not just the focus on the health of our teammates, but the health of our communities.
Really valid point. I think one of the things that probably some of the businesses are thinking about is, what are some low-hanging fruit pieces that I can do within my organization? Not everyone is a large national business. Some are smaller. We're a nonprofit. I'm starting to ask the same questions. What are benefits that we can provide for our team members that are different, that are, giving them an extra PTO day for their postpartum visit, or we also give 8 hours of wellness and prevention screening. So we encourage people to get their flu shots. Historically, we do them in-house when there's not COVID. So we are starting to think about those conversations now, especially we are predominantly with 263 employees, predominantly women. So we're starting to have those conversations. I'm curious across the panel, what are some other low-hanging fruit things that businesses can do where, I know as a nonprofit, we can't do 16 weeks of paid maternity leave, not yet anyway.
You can probably have a bank leave, right? Where people can volunteer and, you have a single person who's, has a lot of time and maybe they can give a couple of days. I've seen that done as well. You can have also, sort of like a bank of diapers or formula that it's money, right? Because right now you can take leave under the Family Leave Act in Maryland, but it's unpaid. So, how do you reduce the financial burden on that mother, on that couple, so they can enjoy that baby? So those are low-hanging fruit that everyone can bring in a can of formula, or adopt that family for a week and deliver a meal that you can charge to your credit card. Like when people get sick and people sign up on a calendar, those are very doable. And trust me, when I had my babies and someone will leave, when I had my twins, my boy was 19 months, and then we said, let's have another one, and we ended up with 2 girls. They're a blessing, but I had 3 kids under 19 months. And it was great to see a meal in the front of my home, and I didn't have to make it. My husband and I were so relieved. Just the little things like that can make a difference.
The beautiful suggestion, Delegate.
I would agree with that. And I would also say that you can engage with your health benefit provider for wellness programs that they already have in place. I think that's a really good place to start. And I also think that you can promote a healthy work environment just by educating on health. You can, as I mentioned, change out your vending machine snacks. Maybe if you have pre-approved caterer like type of companies that offer healthier lunch options, you could do simple things like that for absolutely no cost. And you can also engage your local United Way. I would really encourage companies to do this, and other nonprofits, just to educate their teammates on the community involvement opportunities, and just to talk about the statistics and the information that's out there. I think education is so crucially important to making change. And so when we have these great organizations that can really come in and do a lot of the legwork, who really want to be an advocate for the community, an advocate for people, like HCAM and other organizations, right, that can come in and would be happy to talk to your teammates about what they can do and how they can be involved, and how they can have better health outcomes. So I really feel like there's some things that you can do that don't involve a lot of money, but just involve some phone calls and communication and relationship building with people already in your community.
It's good business practice to be able to support your community. Those are your customers. And so, by the way, it's good wellness for your colleagues. They can get involved in community activities that you support. And there's strength in numbers. If your organization is small, join up with other organizations.
Mm-hmm.
So that you can all start that farmer's market, or go in and fix up the housing in an area of your community that needs it, or subsidize a minibus to be able to take people to the local clinic. Everybody can get involved, and it doesn't cost much if everybody gets involved, or the government, Delegate Pena-Melnyk comes through with a grant. But there's always opportunity, and it takes care of your community, your customers. That's good business. And it really makes you all feel good. It makes your colleagues feel better about working there and working together. So there's a lot of opportunity. It needs organization. It needs those community groups to help you figure out what you want to do, like Andrea said, but it's there. And, if everyone would reach out together, there's a lot that could be accomplished.
I want to make sure I don't miss this attendee's question. Andrea, you mentioned that the Truist parental leave is new. I know it's a combination of 2 banks together. Can you share how your company worked up to a very progressive amount of time, and did Truist model their program on any other companies?
Sure. So as we got together, we took the best of both organizations. So SunTrust had a full 16 weeks of paid maternity leave, and that included their medical time for medical incapacity and their parental leave combined together. And then BB&T had 12 weeks of paid maternity, which was, again, their medical and their parental combined together. The difference is that you had to be employed for a year at SunTrust, and your benefits at BB&T were available right away, so date of hire. And so what we did was we just combined the best of both for us. We knew we wanted to keep the 16 weeks. A lot of our competitors were at that mark, and so it was really important for us to maintain a competitive benefit package. And then it was really important that we keep the date of hire eligibility, because we have a lot of women who actually do get pregnant or are pregnant when we hire them, or get pregnant within the first year. So it was really important that we maintain those benefits for them.
Thank you.
You're welcome.
I want to switch gears a little bit. We are in the middle of a pandemic still, and in fact, we'll hopefully be listening to Governor Hogan in about an hour and hear some more updates about our numbers going in the wrong direction in Maryland. I want to talk about what are some of the unique challenges that our employees are facing during COVID that will affect their staff's health, especially in this maternal health landscape.
I can start. We certainly, being in the hospital kind of environment, you get to see not only people who come in for health care who have COVID and are sick, but also what's happening to our own employees. And what we're really finding is people are getting infected because they're letting their guard down, where they're attending large family gatherings, weddings. I know someone close to me who I work with who got it, and then she gave it to her husband, and her husband got really sick and had a major complication related to COVID. So I can tell you, as an employer at a hospital, having staff go down and on quarantine for 2 weeks is devastating for a hospital. And in my own office, we've had it. And so it's really challenging for employers. And the only thing we can do as employers is to try and say, be careful, wear your mask at all times, wear goggles that you can have when you're out and about. So you have to do all of this to protect not only yourself, but others that you come into contact. So that's the best that we can do. And we're really getting very strict. We're putting more restrictions in again with the COVID going up into visitation and all that. So that's a start, and I'm sure others have a lot to add.
Well, you certainly can't stop. Some surgeries you can delay, but you certainly can't delay pregnancies. They are there, and will continue to come into the hospital for, prenatal care. How has your prenatal care services shifted in the era of COVID?
Yeah, I think at the beginning it changed a lot, and not necessarily good, because I don't think we were organized enough to be able to provide the care. I think there's some models out there, some apps and programs out there where you can provide a blood pressure cuff and a scale that can upload into the web and get your doctor information, just as well as blood sugars. You can get a certain blood, and one that I have where I take my blood sugar and the app and the company knows that I took my blood sugar. So I think we need to get better in medicine, especially with this new increase that we're having, and doing more of this, because we can provide more prenatal care. I'm worried a little bit that we may have missed some things. And I know at the very beginning, everything that came in with a fever was COVID. In reality, is physicians were missing, worried about COVID. In reality, it's not usually COVID. It's the disease that we usually kind of see. So COVID really threw us off our game initially. But I think people who really do telemedicine and telehealth can really do it well and provide a really good service. And I think, I'm hoping our government will allow continued telehealth, because I think it's something that we can get right and can provide very well.
You will see a couple of bills regarding that as well. We're working on that to make some of those provisions permanently, permanent reimbursement as well. I know the Hospital Association is working on a bill. Chris is working on a bill. So it's going to be a tough session, but it's exciting though. It really is.
Well, like the legislators have learned, we in medicine have had to learn how to deal with telehealth. The blessing and the curse of the pandemic is it forced us into doing this, and we needed to do it.
Yes.
To be able to care for everybody in healthcare with the limited resources and the expense associated with it that we had, telehealth was obviously where we needed to go. We just needed to be pushed into it. So there was a blessing behind this. The curse is, of course, it came all of a sudden. None of us are used to it. And there are some downsides. Like Dr. Atlas said, we don't know what we don't know, and we're still learning. And we are trying to work with a number of research, mostly institutions, Maryland, Hopkins, and MedStar, to see if we can figure out what are we missing so that we can teach both physicians, nurses, and patients how to better do telehealth. Because it's new for all of us, and we're learning as we're going, and we're much better than we were 6 months ago. But we've got to learn, because this is the future. It's here now. And thank you, Delegate Pena-Melnyk. We need to make sure that it remains the future, because it's the only way to get to a lot of people, and it's the right thing to do. But we also have to know how to do it right, not just for the healthcare side, but also the patient side.
I would also see that telehealth, when we're back in a world that we actually go into our office, will keep people at work longer. Will reduce people needing to take time off to drive to their doctor's appointment and then drive back to work. And so there are ways in which businesses can integrate. We under the ACA created our nursing mothers room, which is required under ACA, and it was a wellness room. So we also encourage people to take their telemedicine appointments through that wellness room as well, to take a break from work and go have your telehealth call, and then go back to work or to the doctor if they feel that that's necessary.
But we have to also deal with some of the barriers, right? So not every community can have access. Like, for example, the non-English speaking immigrant community, right? They do not even know how to, I know, because I find myself on the phone frustrated, walking them through it, how to sign up and help even their kids at school, at home. That's an issue. So the telehealth is fabulous. It's great. It works, especially in rural areas. But we also have to be very cognizant, very conscious of the, when you have the barriers with the lack of education, lack of technology, skills in certain communities as well.
I'll also add one downside to telehealth, just so everybody out there knows it. Rob and I got into medicine because we care about our patients and we care about that human contact. And there's some of that is lost, obviously, when you're behind a mask or you're doing it over a video. It's not that we don't believe in that. We do believe in that, but we still like that human contact, and we're losing some of that. So we hope get this pandemic over so we can still get some of that, because healthcare workers really thrive on helping people, and that's not just over a video conference. It's being there in the room with them too.
Face to face. Absolutely. And it should never, obviously, telehealth is, there's places that it can be utilized and where it's important, and where it can be helpful in the community. A single mom with 3 kids or a working mom with 3 kids having to take those kids to the doctor. Medicaid transportation doesn't allow her to transport anybody not having an appointment. So all of these systems and barriers that they have to navigate, telehealth could be supportive, but it should not replace the physical face-to-face appointment that one needs with their doctor, whether it's an OB, a GYN, or primary care. I agree with you. As we continue to talk about businesses, I want to reflect back on what resources can we give businesses to help them with maternal health for their employees and then ultimately the community. We talked a little bit about this. So thought potentially, I know Andrea popped off camera, and I know she's homeschooling 2 kids as well. So it could be a school has finished.
Hi.
Day.
Can you guys hear me?
We can hear you.
Oh, well, I actually, the joys of home internet, right? It actually popped me off for a minute. So I'm so sorry to have lost you guys. Can you repeat that question?
I can. We talked a little bit about it already, but resources we can give businesses to help them with maternal health for their employees and ultimately the community. So what are some resources that we can give? There was a comment in the chat of utilizing employee assistance programs for maternal health. We also want to make sure we're screening for depression. I know that is a big piece that Dr. Atlas focuses on in the postpartum period, but resources that we can give to businesses, especially those on the line.
Sure. So I think your EAP I think your EAP programs, to your point, are critically important. If you don't have one, I would definitely suggest speaking with your healthcare providers or your insurance companies that you have. If you have a disability company, they typically offer ones as well. And they're not incredibly expensive, but they're of great value. And so I would highly encourage you to check those out. That would be a number one low-hanging fruit, I think, that you can do. I think another thing, just from a quick employer perspective, as you think about someone going out on maternity leave, is keeping lines of communication open with your employees when they're out on leave. Not to call and have lengthy conversations and ask them, all kinds of medical questions, but just to say, hey, we're thinking of you, we miss you, just wanted to check in, see if we can, do anything for you, and then make sure you're connecting with them about their return back to work and encouraging them along the way, whatever that looks like, whether it's a medical leave or a maternity leave for a family member or for themselves. I think that type of engagement with your team is just crucially important for them to understand how much you as an employer care about your people. And then if we're specifically talking about maternity leaves, I think the small things like reminding your teammates to enroll their newborn in their health insurance. Small things like that will make a big difference in the long run.
So we did have another anonymous question from the business side. What can employers do to support the mental health of moms returning to work? And a second part, probably more for Dr. Ig or Dr. Atlas, can you speak to the mental health needs of pregnant women, new moms, especially considering the isolation of COVID? So a couple questions, I can repeat them if maybe we should start with the mental health needs of pregnant women and new moms. Dr. Atlas.
Yeah, we know that postpartum depression occurs in 1 in 8 women, so it's incredibly common. What we in the medical side have started to do is really that 6-week visit is sort of a misnomer now. And ACOG finally, over the last couple of years, got it and recognized that we just can't see women 6 weeks after a vaginal birth and be okay with that. So everyone is coming back. If you have hypertension, you're being seen in a week. We are recommending that all women come back in 2 weeks where we screen them for postpartum depression and depression in general. I think it's incredible that we have resources available for therapists. I don't think physicians who are not psychiatrists are great at it, but I think talking to patients, recognizing the problem, I think trying to get groups together. I think this isolation for people has been incredibly difficult, especially if you're an extrovert. If you're an introvert, not so bad. You like being by yourself. But for extroverts, it's incredibly difficult and challenging. And so we don't have it currently. We don't have the resources for everyone who needs help. I think in this day and age, we have to assume everybody needs help. And I think getting people, employees talking and regularly seeing how you're checking in. And if someone gives you the old saying, oh, I'm fine. No, you're not fine. They're not fine. there are issues at hand. So I know Blair wants to make a few comments, so go for it.
As usual.
Yeah.
The support groups. Every community has support groups for pretty much every problem you could have. And I don't say that jokingly, it's really true. And usually clearinghouse for the support groups is either the community health department, the city or county, or the local hospital. They know the support groups. A lot of them meet at the hospitals or in community facilities and now have migrated to online. Get involved in the community support groups. They give yet another avenue of people who've experienced the same thing you're going through. And it really does, again, it's that supportive community. I guess I keep coming back to that. We all need to be responsible for everybody else, especially during this time where people are so isolated. And it's really an opportunity. And then I'll put that plug in yet again for a year of coverage after delivery, because a lot of these problems don't go away in 2 months.
And if I may.
Yes, I wanted you to speak.
Yeah, not
I wanted you to speak on the challenges in the communities of people of color and being disconnected.
Yeah, it's a big issue. It really is, because you are forced to, and in the next few months, even it's going to continue the same, to stay home, and you don't have that human contact, right? And human beings, we, by and large, unless you like to be by yourself, you like to be in touch with people. And this is so impersonal, right? Although I'm seeing you, it's not, you can't hug anyone, you can't give a kiss. So the things we take for granted, right? It certainly gives you perspective. But I was gonna say, one thing that doesn't cost anything, and it's not legislatively or even medically, but if you have an employee that had just had a baby, just a simple call, how are you doing? Just a supervisor who that person probably has more of a relationship, just call and say, hey, how are you? Just check in. It doesn't cost anything. And find out how they're doing, and maybe be a little bit more flexible. I am very productive at home now. I mean, I start working, and most of the time I don't get up to 1 a.m. after I'm done. Seriously, that's why I have that extra 25 pounds now. Seriously, people used to think, oh, you're not productive if you're at home. I mean, you are. So be flexible with your employee. So they can get the work done, but also just ask how they're doing. Go the extra mile. That's all people need, really. It's not that complicated.
I think we have to circle the wagons with fellow employees and keep checking in and seeing how we're all doing. I'm fortunate. I don't think I'd be able to survive if I wasn't able to get out of bed and come to the hospital and see patients and see people. I know my partner is struggling with it and struggles, dealing with the child and her job and all that kind of stuff. But I'm fortunate, and we have to get everyone involved and talking about it, talking about their feelings, talking about their anxieties, and things like that. I just think we need to talk more about it.
Wow, I mean, the little things that one can do is so important from the business aspect. I know when I had my daughter 7.5 years ago, I think the best gift I got was a box of brownies. Like, there was just, they're not the healthiest, I know, when we're talking about wellness, but these decadent brownies from New York City were like the best present. So at 3 a.m, when you're feeding your baby, you want your water and your brownie. Not the healthiest, I recognize, but a simple sentiment from a college friend that really, 7.5 years, I still remember the box of brownies that she sent me. So I think those little things, I think businesses can do the same. Maybe we move to the edible arrangement, fruit containers to send people fruit, but I do think that's super important. And I wanted to see if there were comments. Andrea, yes.
Yeah, I was just going to say one other thing. First of all, I love the care package idea, especially for a smaller organization, coming up with some sort of care package idea, whether it's food or diapers and whatever that may look like. But I think something as well that we do that I think is really important is requiring that return to work certification from your teammates, which ensures that they are going and seeing a medical professional that releases them to come back to work. It's a requirement, so they have to go back. And I think that's just really important for our birthing moms to see a doctor before, in that postpartum window. And many of them today, with everything going on, I know are not. And so I think that's something easy that you can do that doesn't actually cost you anything, and ensures that they're seeing and getting the help that they may need if they need it.
Absolutely. Dr. Atlas, I know you spoke before about the low postpartum follow-up statistics for maternal health as well.
Yeah.
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 Any last statements? I want to make sure that there's opportunity if anybody else from the participants have any Q&A questions, but I wanted maybe one or two last statements from the panelists. Dr. Eig, we'll start with you.
What you can think about right now, I probably think most about our friends, colleagues, family who are in healthcare. Healthcare is remarkably stressful right now. And it's not because I'm in healthcare. I obviously got a nice office here. I don't have to, be out there on the wards in the hospital, although I still do go at times. But it's very stressful for workers both in healthcare and hospitals, but also in nursing homes and elsewhere in the community. Understand that if you've got family, friends, relatives who are in healthcare, let them know how much you appreciate them. This is a really stressful time, and especially if they're pregnant or their mom, because it's even more stressful, I think, for them. And so, we'll get through this. We all get together and we support each other and we get through it. But have that understanding about how stressful it is in healthcare right now and throw your support their way.
Great suggestion. Delegate?
Thank you. And thank you so much for bringing us together. And everyone, you could have, done something else at this time and you chose to learn a little more about this topic. I think that to every problem, in order to find a solution, first you have to have an understanding. So you got the facts, you got the science, this is an issue, and we're trying to address it from a healthcare perspective and a policy perspective. And what you see here in an employer perspective is that it takes everyone to try to come up with solutions, and that we have to be creative, and that we have to think in a holistic way. But if I may leave you with just a couple of thoughts, is that remember to do some self-care. Remember that it doesn't cost anything to pick up the phone and check on a friend, and use common sense. And please wear your mask. It's important to wear your mask and stay healthy until we have a vaccine, okay? And doctors on this panel, thank you for the work you do. You don't have to do it, and you do it. Contrary to what President Trump said, I hope I don't offend anyone. This is not political here. This is just Joseline Pena-Melnyk speaking. You don't do it like he said, people are dying and doctors make money, whatever he said about COVID-19, which was so irresponsible, negligent, and dumb. I know that you're putting yourself out there, and I certainly appreciate it very much. Thank you very much.
Thank you, Delegate. Dr. Atlas, any final last words?
Yeah, I know that we've all been consumed by COVID, and I think it's taken us away from where we'd like to get to and where we need to go. I appreciate everything that Delegate Pena-Melnyk is doing, trying to do the things we're doing, but we have to do more. We have to organize better. We have to get better programs in place. I love the idea of the implicit bias, but I myself have taken numerous implicit bias courses, and still it's something that we need to do every day and think about it. I think the biggest thing is recognizing our biases so that it doesn't get in the way of the care that we provide to patients. But we need to, from an employer standpoint, obesity, we didn't even talk about obesity, but obesity is such, and I hate to say a big problem, but it's such a problem that needs to be addressed. And that talks about nutrition. I work in Baltimore City. We have real problems with education, housing, food deserts, all these things that are impacting maternal well-being. And all these things need to be addressed. Yes, there's COVID. And by the way, we need to wear surgical masks, not the cloth masks, because they don't help as much. But it's sort of one of those things that we just have to keep moving and pushing our programs forward. Right now, it's really critical to make sure we're all healthy, both physically and mentally, and really to avoid famine. I hate to say it, I miss, I just had a grandchild born yesterday, and I know I can't see him or my kids, and it's just horrible to think that. And it's just, we got to get through this time, but we still need to keep our eye on the ball, which is moving our programs forward, getting the care that patients need, and getting from a statewide, getting that year. We need more mental health providers and programs out there. So I wish everyone well, happy holidays, happy new year, and may 2021 be a better year for all of us.
Thank you, Dr. Atlas, for your words, and congratulations on the birth of your grandson.
Thank you.
Andrea, any final words from the business world? That's a lot of pressure on you, I know.
Well, first of all, thank you again for allowing me to be with you guys this afternoon. I think at the end of the day, I would just encourage everybody to keep open lines of communication with your teammates, whether they're actively working or out on leave. Ask your teammates what would mean the most to them. Ask your teammates if you were to do something to help improve your overall benefit package, what would that look like for maternity or parental leave? Ask them what's important to them. That'll go a long way. And then for the people who are out on leave, as I think several people have indicated already, just picking up the phone and staying connected with them, especially in this time that we're dealing with, that human connection is so important. So that's my biggest takeaway for you guys, would be to just continue to talk to your teammates. It's so important.
Absolutely. And as a nonprofit in Baltimore City, based in Baltimore City, but serving across the region, and we serve a variety of individuals accessing health insurance and care coordination services. And a big piece of the population that we serve are pregnant and postpartum women, helping them navigate their Medicaid benefits and getting them connected to supportive services. So I just encourage you all to check out our website, check out the work that we do. There was a Here to Help hotline, which has access to mental health services. So that was put in the chat. But check out our website, follow us on LinkedIn and Facebook, and learn more about the maternal health services that we're providing to the community, so we can get our moms healthier. And I just appreciate everyone on the panel today, and thank you, because you could have been somewhere else as well. And so I appreciate your time today. And please join us for our Day of Giving on December 1st. We'll make sure that you learn more about that. But thank you again to everybody for your time and attendance today.
Thank you for your leadership.
Thank you, Delegate.
Bye.
Thank you so much.
Thank you.
Have a great day.
Take care of yourselves, everyone.
Thank you, everybody.
Bye-bye now.
Bye.